Good morning, colleagues. I really wish that I could be there with you, and I apologize that I'm not able to be there with you on this occasion. And apologies for the surroundings that I'm sending you this video from. As you know, we're experiencing a resurgence of COVID-19 transmission in the United States, so we're all sheltered in place, trying to control the spread of the pandemic. But nonetheless, I hope that this message finds each and every one of you all in good health and spirits. And I want to thank the organizers for today's event for the opportunity, particularly Richard Lasimbo, for the opportunity to address you on this most auspicious occasion of the launch of the framework for the Uganda Key Populations Consortium. I also want to send greetings to my fellow advocates and agents of change who are working tirelessly each and every day to end the global HIV pandemic the only way possible, by recognizing the dignity and value of each and every human life and the right to accurate sexual and reproductive health advice and quality healthcare services free from discrimination. I want to applaud each and every one of you that are in the room today for reaching this incredibly important milestone. Having spent the last 18 years of my career advocating an equitable HIV response that prioritizes HIV prevention needs for gay and bisexual men and other men who have sex with men, transgender men and women, people who use drugs, and sex workers, and treatment on demand for all people living with HIV. As you heard in my introduction, I work for the Elton John AIDS Foundation, where I center those who are most affected by the HIV epidemic and support civil society to increase evidence and innovation to demonstrate how we can close gaps in HIV outcomes and expand human rights for LGBT communities globally and in the United States of America. We believe at the foundation that AIDS absolutely can be beaten when we come together to respect and recognize the value of each and every human life and tailor our local HIV responses to meet the needs of communities who simultaneously bear the greatest HIV burden and barriers to HIV prevention and treatment. Between 2016 and 2018, programs targeting key populations received only 2% of all HIV funding and just 10% of HIV prevention funding, while key populations accounted for over half of new HIV infections. At the same time, investments in key population funding fell short by 80% in low and middle income countries. When gay and bisexual men, people who use drugs, and sex workers account for 20 times as many, and transgender women account for 12 times as many HIV infections as occur in the adult general population. This is a call to action for all of us to again come together to close the resource gaps and redouble our prevention and treatment efforts. Not doing so will render the achievement of the UN AIDS fast track goals by 2030 completely out of reach. In 2016, the Elton John AIDS Foundation partnered with the US government and UNAIDS to launch a nimble, inclusive, and effective mechanism called the LGBT Fund to help respond to this very challenge. The fund established a three-pronged approach to address structural challenges and bridge critical gaps for LGBT people by improving access to HIV and STI prevention, care, treatment, information, and services. Uganda was selected as one of the countries that we worked with for the Deep Engagement Program, and while additional support was provided to Uganda through our Rapid Response Fund, as well as our advocacy mechanisms. The results from this work underscore the value and importance of collaboration at all levels of the local HIV response and across key affected communities. Uganda is one of the 32 countries in Uganda where homosexuality remains criminalized, contributing to stigma and discrimination and limiting access to life-saving HIV prevention and treatment services. Improving access to HIV services among key populations at increased risk of HIV infection is further hampered by a number of factors. The lack of information available to the LGBT people and other key populations, stigma and discrimination, weak linkages between health facilities and community-based programs, and stockouts of antiretroviral medications. The Uganda Deep Engagement Grant was developed to address these very challenges and despite the challenging context, for those who tested for HIV, 92% were linked to care, and 81% were initiated on antiretroviral therapy. The seropositivity rate was 10% among LGBT people tested through the program. The Deep Engagement Grant Consortium managed to significantly increase access to HIV and sexual and reproductive health services for LGBT people and exceeded all targets and expectations in almost all areas. The Uganda Deep Engagement Grant Project was also implemented by a consortium of implementing partners to attend to a wide range of clinical and sociocultural needs for among LGBT people. The program was implemented in 20 districts through 15 implementing partners. These kind of partnerships are exactly what the fund was designed to support, so they can reach LGBT people who are most at risk and keep them safe, complementing broader LGBT human rights work. The fund further aimed to address stigma and discrimination, increasing the capacity of LGBT community-based organizations to deliver HIV and STI services and advocate for the rights and health of LGBT people broadly. At the end of March, when the government of Uganda imposed a national lockdown to contain the spread of COVID-19, travel restrictions, physical distancing, curfew, and concerns of potential exposure to COVID-19 in health facilities placed additional impediments on access to treatment and other essential services for key populations living with and affected by HIV. The majority of key populations living with HIV suffer from limited financial resources, a condition that the pandemic only threatened to worsen. To mitigate these negative effects that might cause on HIV and STI prevention, adherence to ARVs and sustained viral suppression's health benefits for key populations living with HIV, as well as onward transmission, the Foundation, through its COVID-19 Emergency Support Fund, was able to continue to support one of the Deep Engagement Partner programs to help provide access to self-testing, HIV prevention supplies, and food as a means to protect the gains that were made during the supported program. Allied Medical Services, also known as AMS, has been able to reduce the negative effects associated with COVID-19 among key populations living with HIV, while also ensuring the health and safety of their frontline workers. Soon, we hope to see the work started with the Deep Engagement Program continue, augmented by the launch and partnership made possible by this very KP consortium in Uganda. I want to bring these comments to a close today by recognizing the incredible leadership and promise that is demonstrated today by the launch of this consortium. Your collective will and organization will add both power and capacity to define and advocate for the issues that are most urgent and most important to improve HIV outcomes and quality of life for key populations in Uganda. I want to send my distinct regards to the Uganda Harm Reduction Network, Sexual Minorities Uganda, Uganda Network for Sex Worker Organizations, Trans Network Uganda, and other key population organizations who will work tirelessly to achieve greater progress in the future. My colleagues and I at the Elton John AIDS Foundation look forward to continued dialogue and partnership with your efforts in the future as those opportunities present themselves. Thank you for the invitation to be a part of this most important event. I want to wish you all the greatest success in all of your endeavors. I really wish that I could be there with you to give you my regards and well wishes in person. I am honored to be with you, and I am most proud of your progress and your success. Wishing each and every one of you well, and I hope to see each one of you soon. Take care.